Hey guys, Abe Ovadia here. We're at WorkComp 2023. I got here with me Dr. Maulik Bhalani with Florida Pain. Doc, how you doing today?
Good. How are you?
Good. Thanks for coming, man. Wanted to welcome you to the podcast. Say thanks for coming on here. I know there's a lot going on. How's WorkComp treating you so far? How's the conference holding up? Fantastic,
man. This is always a really good conference. It's just so much energy downstairs as it is. You know, the exhibitors really do it right. Great place to make a ton of connections with work comp adjusters, case managers, attorneys, and so forth.
Yeah, I love the networking opportunities that are out here, just meeting people, seeing familiar faces. Speaking of exhibitors, I noticed you're in a referee outfit. Do you know the official theme of the, because I always screw up the themes.
It is Get in the Game. So, this year was Get in the Game. So our whole team dressed up as referees. Okay. We had, I wish I brought it, but we had a flag, yellow flag and a red flag, penalty flags. Our whole booth is set up around a sports theme. So people actually did either a sports theme or a game theme, like, casino games or things like that. So yeah, it was all just about getting in the game.
I saw someone had the dodgeball from the movie, Ben Stiller?
Ben Stiller movie. Yep.
Yeah. Cool. Okay. Yeah. We always manage to screw up the theme or get it wrong. And so excellent work.
Yeah. It's funny. One of the people told me, they're like, man, nobody likes referees. So you guys will get great people coming to talk to you because nobody likes referees. I was like, that's true.
And those shoes are sick, by the way. I love those shoes.
Thank you. Yep. I got the old Reebok Shacks to go along with the theme. You can pump it up as it is. Great.
That's awesome. Cool. So, you do a lot of pain management, obviously, as the name indicates. You guys are in which cities are you guys in? You guys have a couple offices.
Yeah. So we have 7 offices. Our practice is called Florida Pain Medicine. We have 5 offices in the Tampa Bay market and then 2 offices in the Daytona Bay market. We have a connected surgery center now in Tampa, which we've also built out. Nice. So been in existence for about 12 years since I graduated fellowship, but Florida Pain Medicine has essentially been around 8 years, and we've just grown slowly, organically, and doing it the right way. It takes a long time to grow.
Yeah, awesome. And what are some of the common procedures that you do? And then if you could just tell us about the other docs in your practice, if they do anything different specialty wise.
Yeah. So, all of our docs are fantastic. Let me just kind of start with that. But, and we all do very similar things. But, the procedures that we do is interventional pain management. We focus on, and the keywords you always want to know going to a pain management doctor is, multidisciplinary, multimodal care. So we don't just prescribe opioids or anything like that. We truly believe in interventional pain therapies. So our motto for our practice, for example, is restore function, relive life. Like, we care more about your function, how you're doing. Can you play with your kids? Can you play golf? Can you hang out with your grandkids if you're an older person? Enjoying your life, and really, that's what it's all about. So we do things that, simplest things procedure-wise, from trigger point injections all the way to epidurals, radiofrequency ablation, spinal cord stimulator implants, SI joint fusions. And we've actually started a lot more even doing other things like regenerative medicine. So I myself, I'm sorry for another time, but I myself actually had a bone marrow aspiration stem cell injection done to my hip. And then we just brought on, especially for the personal injury space and the workers' comp space, we just brought on a neurosurgeon who is a spine-trained neurosurgeon who'll be operating out of our surgery center in Wesley Chapel as well.
Okay. And so you mentioned the stem cell. That's where they take a piece out of the bone marrow from your hip.
Yep.
Take it out, and then they take the stem cells from that and they inject it into whatever area
is damaged.
Yep. Okay.
Yeah. So basically the way the procedure works is, if there's a couple of ways to do it, right? The older way, the embryonic stem cells, the stem cells in a bottle, usually not as effective. A lot of FDA regulations around it now. But if you do it autologous, which is basically somebody, myself or somebody else, will take it's called a Jamshidi needle. They will put it into usually the iliac crest. It's kind of like a drill. So they'll drill down into it through the iliac crest into the bone, an inch into the bone. They'll basically aspirate out bone marrow, advance it, aspirate out some more bone marrow. And bone marrow is just really thick blood, really is what it is. Okay. And so then they'll spin it down, get all the best cells out of there, which are the stem cells, and then re-inject it. For my example, they did it on a torn labrum in my hip.
Okay. Wow. Awesome. That's cool. And how long does that procedure take, and when can somebody go back to work? I'm just curious. Is that like a 15-minute staying? Is that a couple hours? Is this intense?
Yeah, it's intense, but you're sedated. So, which is nice. So usually we give patients a little IV, and then through the IV, they get some sedation, Versed fentanyl usually. So they're in a twilight sleep. They don't remember much of it. I don't remember any of it, which is kind of nice, but we don't put you completely to sleep. And, the bone marrow aspiration site usually does hurt, but, outside of that, patients do great, man. The recovery starts pretty quickly within 2 to 3 weeks of actually starting to see healing from soft tissue that's damaged. And then over the first 3 weeks, it kind of continues the first 3 months, it progressively gets better and better and better and better. And at 3 months is kind of when the recovery or the healing kind of plateaus, and it should stay, healed essentially.
Okay. Cool. And you're happy with your procedure? It went smooth?
Yeah. My procedure went great. It's beneficial. I just think, does it still hurt? Yeah. There's still a degree of pain. Yeah. But, can I play basketball with my kids? Can I, ski? Can I do all these other things? Absolutely. Which is really, really, really nice. Because I can't imagine what it would be like if I hadn't had it done.
Okay. And so you're saying that it's still sore, it still hurts, but that's expected to go away, that pain. Yep. From where they took the bone marrow stem cells.
No, that's gone. So the bone marrow, the bone marrow aspiration pain, it lasts you maybe, it hurts for about, a few days, like 4 or 5 days, maybe a week max or something like that.
Okay. So the site where they took the stem cells, that's 4 to 5 days. But now you're feeling a lot better. You still have some pain is what you're trying to say, but you feel way better than originally. And you can do things like play basketball. In those cool shoes.
Yeah, exactly. Well, that was the most important thing. Like I said, I didn't want to take it away from me playing basketball with my kids, me playing football, running around with them. So that's the most important thing.
Yeah, cool. Awesome. I just got into biking. Yeah. And I got so far into it that I bought the pedals with the shoes.
Oh yeah, the shoes.
It's I'm kind of a weird story, man. I got the MRI center in Boca about I think we just celebrated our 6th year.
Awesome.
And thanks. And when I got the unit, I was like, my knees had been hurting me a lot. And I went and got it. And we put a brand new 3T MRI in, and I went and got my knees MRI'd, and it came back clean. And I'm not kidding you. Ever since then, I've had no knee pain. It was all like a weird cycle. I was like, oh, I got these old man knees and this and that. Telling my friends, you want to play basketball? I was like, nah, I can't play basketball. I have my knees. And now, so anyways, ever since I got the MRI, I've been feeling great. And it's just a weird psychological. And then, so now I started getting into biking and stuff like that. It's great.
Yeah.
Do you do any biking at all? Or
no, I'm not a biker. No. I'm a much more sportsy guy. So, skiing, basketball, football. I'm a pretty degenerate sports watcher. So all Tampa fans. So we have season tickets, Lightning, Bucks, everything. So yeah.
You just reminded me from Eastbound and Down. He goes, the guy was he was like a biker, and he goes, and then the main character's a baseball player. He goes, I'm an athlete. I'm not trying to be the best at exercise.
That's true. That's true. Yeah. Biking sounds like a lot of work.
Yeah.
Playing basketball is not so much work.
Yeah, I got stick legs, so I gotta beef them up. But anyways, cool. So you guys do facet injections, epidurals. You said ablations. You guys do obviously this type of stem cell therapy where you take out the bone marrow. Do you guys do PRP, or do you not feel that's effective?
PRP is part of that regenerative cascade. So, initially, like for soft tissue, PRP actually works fantastic too. A lot more cost effective than actually doing a bone marrow stem cell injection. And if it's a soft tissue injury, PRP works great. And you don't need to hold bone marrow aspiration. You can literally just take a little blood from your IV, and patients, do very well with it. But again, for soft tissue, elbow injuries, joint pains, knee pains, myofascial pains, muscle pains, things like that. But not for, if you're talking about torn labrums, it'll still heal it. But if that doesn't help, then you go to stem cell.
Okay, you go to stem cell. Okay, cool. And you're not a fan of the buying the vial embryonic fluid.
No.
You don't. Okay.
No. And it's because, again, there's been so many people when it initially started out, people were just putting all kinds of stuff in there. And that's why the FDA really came down on it and said, hey, no more. Like, we don't know what's being put in these vials. Everyone's promoting it as, embryonic stem cells, mesenchymal stem cells, different things that are there, but nobody really knew. So if you actually want to do that, there are stem cells that are grown, from an embryo, you got to go all overseas to do that stuff. But,
okay.
Yeah, but we do a lot of other stuff, like from an advanced procedure standpoint. Some of the big things that we really try to focus on is, patients who've had back surgery in the past and now just don't get better with like facets, epidurals, things like that, or radiofrequency ablations. Spinal cord stimulation, it works great. It's like a pacemaker that you have for your heart. What's a pacemaker, right? It's putting two little electrical wires over your heart so that it acts right, over the nerves of your heart so that the heart starts beating in the correct pattern. Same thing with the spinal cord stimulator. We take two little wires, put them into the spinal canal right over the spinal cord. Beauty is the patients get to try it before you buy it. So you go home with two little wires. It's kind of quirky, but two little wires coming out from your bag. You can't shower for a week. Your spouse hates you. But they intercept their pain signals. And if they had pain in their low back or legs, or they had hand damage or something, and literally either we can overstimulate the signals, and so instead of feeling pain, they feel like a vibrating massaging sensation, or we can literally turn the pain off through what they call a higher frequency stimulation. So it's a really nice option for patients.
Okay, that's cool. And so why is there a trial period for a week? Are you trying to see if it works, or are you trying to see if you need to adjust it?
Yeah, both. So, one, the implant is what's expensive. And the implant, which is the battery is like the size of $2 silver stacked on each other. It's just like a pacemaker size for your heart. But, before Medicare or any commercial insurance companies do it, we follow Medicare standards when it comes to the algorithms we follow for treatment. Medicare wants to make sure that the trial goes well before they open up and say, hey, we will go ahead and pay for a larger, more costly implant. Okay. 99% of the time it's covered by insurance companies as it is. Okay. But they want to make sure that you do well prior to it. Even pre the trial, they make you go through a psychological evaluation, one-time visit to make sure that, hey, you don't have issues. Almost everyone passes, but they want to make sure that, hey, you don't have psychiatric issues. You're competent enough to handle a Bluetooth device. And anyone has a smartphone these days can. So yeah.
Okay. Yeah, it's kind of interesting. The first time I ever heard of a spinal cord stimulator, I had a doctor. He wanted to do it on the patient. The patient was like, no, I want to think about it. She was actually a drug addict. She was going back and back for more pills, constantly delaying the procedure. She had the procedure and then still reported pain. And that's kind of where the guy goes. He goes, something's off with this lady. Like, that procedure, everything's perfect. It doesn't make sense. And became evident at that point that that's what that was. She was an addict, unfortunately. So does this kind of, there's no medicine when someone's on a spinal cord stimulator. If they're on pain meds, they should come off of pain meds, generally speaking.
Yeah, so the goal is to mitigate, their opioid utilization. So we tell patients all the time that, hey, listen, if you're doing well with it, then go ahead and start weaning down your pain meds. Obviously, America in general has had a huge opioid epidemic, opioid crisis, especially South Florida, Central Florida.
The whole of Florida.
The whole of Florida. Yeah.
Daytona,
Kentucky, everywhere, right?
Yeah.
It was everywhere. And so now between, again, FDA, Medicare, CDC, everyone's gotten guidelines. And our goal as interventional pain docs is, do we see patients that are referred for pain meds? Yes, all the time. But our goal is, hey, let's do the right thing. You've had cancer pain, no problem. You've had multiple back surgeries. You've tried things like spinal cord stimulation, epidurals. Okay, that's a legitimate candidate. For most of the part, we want to try to wean these patients off these addictive, bad-for-you pills that are out there, and truly, put them on anti-inflammatories, muscle relaxers, interventional treatments. Physical therapy is great, and then that's one of the big things at work comp here. You want that work comp injured patient to really try to get them back to work. Well, how do you get them back to work, right? You don't want them on addictive, habit-forming meds that are going to make their minds foggy and continue to debilitate them as it is. You want to get them, with physical therapy. You want to do a couple of procedures so they're feeling better and getting them back. Maybe not at the same capacity where they were. If it's a forklift operator, for example, that's sitting on his back and the forklift is kind of bouncing him all day. And they've had a blown out disc or, a herniated disc in their back and they do better. Well, maybe that's not the right fit for them. But, getting them to another more stationary job, but getting them out of pain so they can function is the key.
Awesome. Yeah. And, oh, that's great. That's really cool. Any other types of procedures you guys do and maybe unique separates you from other pain management doctors that you guys do really well, different from other people?
Yeah, I mean, just going kind of along those same lines, everyone does the injections and stuff. So we also do, kyphoplasties are a big thing for us, right? So kyphoplasties, anytime a patient, whether it's, LOL, which is your little old lady, not laugh out loud, but your little old lady like has a compression fracture, she steps off a curb, fractures her back, and they're miserable. And so, getting a kyphoplasty in there where we take, again, a jam sheeting needle, walk it right into the vertebral body. You can do it two different ways. You can create some cavities, or you can actually take a balloon, inflate it, and put some cement in there and pop it up. So we do peripheral nerve stimulation. So actually, my mother-in-law may actually eventually have this done because she had a total knee replacement. And then, of course, the orthopedic surgeon says, well, I fixed your knee and mechanically I did everything I could. And they did, right? They don't see any misalignment, but she still continues to have knee pain. So now what? Right. Mm-hmm. So now we can take a PNS or peripheral nerve stimulator, walk it right along a couple of the nerves in the knees and do the same thing, give them signals where the nerves are now overriding them. So lots of little cool procedures that are out there. Wow. How I like to talk about pain management, and even for you guys or any, attorneys, lawyers, same thing, but attorneys, lawyers, adjusters, patients to think about it, or even primary care doctors or referring doctors. Pain management has gotten into this space and is a niche now where cardiology was years ago. And so initially what happened, let's say late 70s, 80s, when people had chest pain, they would go to the cardiothoracic surgeon. And that was their first stop. Mm-hmm. And now, if you have chest pain, nobody goes to the cardiothoracic surgeon. You only go to the cardiothoracic surgeon when you actually need an open heart surgery or lung surgery or something to that extent. Mm-hmm. Pain management should be thought of in that same space, right? You have a spine surgeon that's there, or an orthopedic surgeon that's there. The primary care doctor or the attorney should always say, hey, let me get it to the pain management doctor first, because we are generally the first option for can we avoid doing a surgery? If the patients need a surgery, there's always that option. But we've really kind of become that space where cardiology is to cardiothoracic surgery, where pain management is to surgical procedures now.
Okay, awesome. Yeah, I noticed pain management went from, a lot of people think of pain management as like the pills from the pill mill, stuff like that. And now they're realizing, well, wait a second, there's interventional pain, which is, injections, procedures, stuff like that. Obviously, there is some of the pills because there's just so much people could do. But I see it coming more and more, and a lot more surgeons are starting to refer to pain management now. And they're focusing more on surgeries and having the pain management guys. Are you seeing that? Like a lot of surgeons are referring for pain management first?
Yes.
Sure.
So, and what's happening is, again, it's a good blend because in the past, so, funny we bring this conversation up or you ask this question because we just had a talk and we do back-to-back conferences. The FCA was here 3 days ago, which is a huge chiropractic conference. And our practice, important thing I forgot to mention, but our practice is actually a core facility for University of South Florida's Pain Medicine Fellowship. So all the fellows, all the future docs that are actually interventional pain docs go through our practice. They train at our practice, all 6 of them, as well as the 4th year and the 3rd year residents from University of South Florida.
Oh, awesome.
Well, my lecture was actually with Susan Welch and Jesse Bexley, who are chiropractors, the only 2 state-employed chiropractors, obviously in the entire state of Florida, and they are part of the USF Department of Neurosurgery. Why? Because what happened was, and this is their words, what happened was the surgeons were getting 10 patients that they were seeing a day. And of those 10 patients, only 1 was a surgical candidate. And so, now that they have the chiropractors, we have a very symbiotic, great relationship with the chiropractors. What the chiropractors will do is initially triage them and go through the right things. Anti-inflammatories, physical therapy, chiropractic care, they're not getting better. They'll send it to the pain management specialist, or even the surgeon will send it directly to us to say, have we tried everything else besides surgery? And the result was fantastic. Mm-hmm. Now what's happening is the surgeons that are actually seeing the patients, 1 out of 2 patients is actually a surgical candidate and gets surgery instead of 1 out of 10. So they're wasting a lot less of their time.
Yeah. Okay. And then obviously the people that don't need surgery are just getting better care sooner with somebody like you who could help them avoid surgery.
Yep.
So that's awesome. Okay. That's really cool.
And sometimes they don't even need to make it to us. They do, if a patient does well with just physical therapy and chiropractic care, that is great. I don't ever want to stick a needle in you unless I have to stick a needle in you.
Yeah. Unless it's so bad that it, warrants it. I get it. Yeah. That's awesome. Cool. Tell us a little bit about you. What, like if your patients were watching this, what do you do for fun? What excites you outside of the office?
Yeah, I am a big proponent of sports and family. So, family comes first for me as most of, my patients and everyone else. So we have 3 little boys that are, super active, wife at home as it is. So spending tons of times with them, going on lots of vacations. I think that's what I tell people all the time. The thing I value most in my life is time, not money, not cars, nothing else. It's time, because that is the one thing you cannot replace and get back with your wife, kids, family members, friends, any of that stuff as it is. So, taking lots of trips. I'm an avid skier, love skiing, love
terrified. I'm terrified I'm going to mess up my knees. I'm going back.
Listen, you can get an MRI and it'll get fixed and magically better again.
Yeah, I know, right?
So that's really it. And I have a huge passion for teaching, and that's why our practice really believes in the whole teaching of future students, residents, the PA program as well. So
you did a great job. We had a lecture for like 40, 50 chiros in Tampa area. They were getting their continuing education, and you came by, gave a course on interventional pain. It was great, really useful knowledge for me, for them. The thing I first of all, I love chiropractors. I go to chiropractors all the time. The thing that I liked about that course, which you taught, was it's like where chiropractic and interventional pain can connect. Yeah. Because it's not just, okay, chiro didn't work out, send them here. This doesn't work out, send them there. Where do they connect? And I think for them, it was a great opportunity to ask you questions and get some feedback about it. So I think, you're an excellent teacher. Yes.
No, thank you, man. And I appreciate the opportunity you guys gave us. It was a fantastic, not only networking opportunity, but, just an opportunity to kind of educate, the people of, hey, well, what are we all doing this for? Right. Mm-hmm. Like, yes, certainly we're doing this for the, glam and fame and money and all that stuff is great, but you're ultimately doing this for patient care. And if you and the chiropractor, or you and the primary care doctor, or you and the surgeon can all be on the same page, that's how patients do better.
Yeah. Yeah. It's, we just got back for my first time to Europe, trip to Europe. That was great, man. We like cruising, and we went on a cruise from Spain to Italy and one stop in France. Have you ever done anything like that?
Dude, I did the same exact thing, okay. I think. So we did, actually, it was left from Italy, and I think it did Greece, Ephesus, I believe, which is, I think Jordan. I can't remember which country it's off of.
I think I'm doing that one next year.
Yeah, it was great. So all of those places in Spain, Europe are all really, really, really nice to do. Mediterranean cruises, the one thing I didn't like about it was, they were like, we were in Santorini, and they were like, you should, guys, they call the sunsets in Santorini the sunsets of fire. They are the most amazing thing. The water turns red. But you guys will be getting on the boat at 5 p.m. today, so you'll miss it. And I was like, great.
So you're complaining about when you have to be back on the boat, which is weird, because every stop that we did, they go, you need to be back at 5:30. You need to be back at 6:30. You need to be back at 9:30. And it was kind of frustrating. We should just pick the set time and we come back and that's it. But it was, every day it was like, what time do we got to be back at? And you forget. It's confusing. You're on vacation, whatever. But it was great. You get to go to a different city every day. Basically, you wake up in a different city, which is cool.
Yeah, which is really cool.
Yeah, my kids. My son just turned 10. My daughter's 8, so they had a blast. We're in one little room. A little bit of fighting the first few days. I mean, it is what it is. Little kids, they don't know how to behave after they're hungry or tired or whatever. But we had a great time. We went to Spain. They have topless beaches. My son, this is a funny story. Normally he sits there in the sand. He's just digging a hole next to the water, and he likes to make a hot tub with, he digs a hole and the waves come in, and he fills it with water, and he's in that pool. And this guy walked for 30 minutes that way this time. First time I ever seen him. He's walking 30 minutes. He comes back. He walks 30 minutes the other way. And I'm like, oh man, he's just enjoying himself at 10 now. He's
it's
living the dream.
Yeah, different exposure, right? So our boys are the same. Our boys are 11, 9, and almost 8. So he's 7 now. Yeah. But it's the same thing. You know, we're both going to cross that bridge where it's going to be, you know, the onset of puberty, a little bit of talking back, a little bit of getting into girls or whatever they're into. And it's like, whoa.
Yeah, the girls I can deal with. The talking back, I can't. He's fun. We wrestle a lot. I pretend to be the macho man. And then I got these cool shades. Like you got those shoes. I got the shades that are macho man, ready macho man. And we wrestle. And it's mostly him jumping from the top of some high thing onto my back. And we have fun. But I know in a couple of years, like they say when they're 12, 13, 14, they want nothing to do with you. It's all about the kid, their buddies. And I'm like waiting for it. But I'm also like, I don't know, man. I don't know.
I don't want that time to come, man. Yeah. If I could freeze time right now, it's perfect.
This is a good age. Yeah, it's a good age. Yeah, a couple years ago, it was a little way. Now they're like the right age. Yeah. And my daughter's 8, and she's already talking back, slamming doors in my face. Wants to wear makeup, crop tops.
Oh boy.
Yeah, I'm like, I don't know about this crop top situation here. But yeah.
Yeah. So, I think God decided for us not to have girls for that purpose. I'd make him wearing like winter jumpsuits all day in Florida.
Yeah. My buddy Alvaro, who he's here with us at Work Comp, he's got 3 daughters. He's blessed with 3 daughters. We like to say,
But you know what they say? Daughters will take care of you long term.
Oh, okay.
Boys don't take care of their parents long term. So my wife and I have decided, you know, we need to start investing in some nursing homes. Maybe we'll hire the staff.
Yeah. Oh man, that's funny. Yeah, I go. You know, Alvaro just came up with this. I go, you know, if you only have three girls, it's because you're a good lover. That's what you know. That's his comeback because 3 girls. That's what he got. My mom found out. My mom just knew he had 1 kid. She didn't realize he had 3, and I showed him the photos. She goes, "Oh my God, 3 daughters." That's a lot. 3 boys is a lot, man. That's a lot. Yeah. So you guys like to travel anywhere cool that you would prefer to be? Like, what's your favorite place to travel to?
Yeah. So my favorite places, so the boys, right? We are mostly anti-device, mostly anti-soda. So the first time we went to India, which is where I'm from, right? So I was born and raised there till I was 10.
Oh, wow. Okay.
And then moved all over New York, DC, Phoenix, went to med school at Creighton up in Omaha, Nebraska. But the boys, we took them to India, and they had never had
people in Omaha, Nebraska.
Well, only because they had a med school.
Oh, okay.
So but yeah, we took the boys to India for the first time. I didn't say anything to them. We got there, we landed. We're like, guys, you can have soda every day, and they were like, whoa, what just happened? So India's become one of our favorite places to go. I really want to. I joke with people, but I think that's going to be very important at this point in life to keep them grounded. Mm-hmm. More important than even them being educated, because they have lots of things in life, right? I mean, both of us are blessed, fortunate that our kids can have lots of nice things in life. But again, you want them to be grounded. You want them to always be nice to everybody. Never think they're above anyone. So I think having them expose that culture in India all the time of seeing what real poverty is, not poverty in America, but seeing what real poverty is, seeing, what real chaos is, traffic is, population is, pollution is, all of those things are great. And then, Africa and Costa Rica, they're the other 2 places. I mean, if you haven't been there with your kids, I would really tell you.
Not with the kids, I went with my wife to Costa Rica.
Yeah, so we went to Costa Rica with the boys 2 years ago. And they absolutely loved it. I mean, zip lining, canyoning, the hanging bridges, hot springs, all of that stuff. And we plan to go to Africa probably next summer.
Oh, cool.
But another amazing trip.
So you guys really like travel.
Yeah. So those are some of our favorite places to go, though.
Cool. That's awesome. Yeah. Where am I looking to go forward to? We do want to book a trip to Costa Rica with the kids. I only got to go. She was going to go on a girls trip, and they all canceled. It was a yoga girls trip. They all canceled on her. So I was like, "Your friends suck. I'll go with you." And we had a great time. It was like a yoga.
Did you guys do yoga?
No, I wasn't doing yoga then. I did. I do like to do hot yoga. I like it. It's fun. They got a really cool place in Delray that I go to. It's awesome. I don't know why I love hot yoga. It's like being in a sauna and doing yoga. And then we went to that yoga place. They have a volcano up there, right? Yep. Yeah, it was super cool. So yeah, that's a long flight to India. Is it one direct flight?
Yeah, we usually go when we go Orlando, which we're in Orlando now. So we go Orlando, Dubai, which is 14 hours, I think, on the way there, 17 hours on the way back, something like that. It's pretty intense.
You do Emirates when you fly there?
Emirates.
Yeah. That
the
plane
only
is
way
sick.
to go is Emirates if you're going to do it.
Yeah, the bar in the back of the plane, they have that bar with the food. You get food any time of day up there.
Yeah. And it's really nice because, again, like I said, that's the one time I really enjoy my sleep because the time difference is exactly 11 and a half hours. As odd as that sounds, but it's 11 and a half hours. So you are completely on the opposite clock when you're in India. And so, I try to reset the boys. Like if you're going to ever do it, even if you're going to take the kids to Europe, I try to reset their sleep cycles before we go. So I'll wake them up at like 2:00 in the morning and be like, jack them up on candy and pancakes and whatever they want, like 2:00 in the morning, like, and then by the time they get on the flight, like they're exhausted by 5 p.m. So it, helps them kind of start that reset cycle as it is. We still get up at 3:00, 4:00 in the morning for the first, 5 days or so, or 4 days. But when we go, we try to go for like 2-3 weeks. Because you need that because it takes you 2 days to
there's so much to do and all the time to get there.
It takes
I went to, this is a funny story. My buddy it was his second marriage and he's on his honeymoon. He said, do you want to come with me? And he's my best friend since high school. I was like, I would love to go on your honeymoon. So I went with my wife and him and his new wife to the Maldives. And so we flew to Dubai and then from Dubai to Mala and from Mala to this little island. And then we took a boat from that little island to a little teeny tiny island. And it was so much fun, but it was over 24 hours of travel in one setting, which was exhausting because the longest plane ride I've ever been up until then was 3 hours. So, but Dubai, those people know how to fly. They got the Emirates. They know how to travel. So, that was great. I'm starting to get into travel. The most I ever traveled was like 3 hours. Bahamas, that was like the spot. I would love going to Bahamas. Atlantis Hotel is beautiful, but there's so much other stuff out there.
Have you been to Baha Mar out there yet?
I'm weird, man. I find one thing I like and I just do it over and over again. And so I just been Atlantis. I've never been to that other place.
You got to switch. I'm telling you, especially with the kids, if you're going to go with the kids, Baha Mar has this amazing water park now. Amazing water park. So we were Atlantis people too. So I loved going to Atlantis. The kids love seeing the big manta ray and the little aquarium. They love that stuff. But as 8 and 10-year-olds, you take them to Baha Mar. It's a nicer, newer property than Atlantis, but probably exactly how Atlantis was when it was initially built.
Yeah.
But then there's a connected water park, and that water park is amazing for the kids. Tons of lifeguards out there as it is, but it's just overall a really, really, really nice facility.
Yeah, I'll check it out. I'll tell my wife. It's we got to do some investigating.
Yeah. And then Maldives is amazing. We went actually for our 10-year anniversary.
Oh, cool.
As well. So, one of the cool places we've both been together. We stayed at an old resort called Barrows. And it was one of the, it's just land in Male and boat over for like 30 minutes or so. One of the oldest resorts that's there, but what also means it has one of the best reefs that's there. So, when you guys went, did you guys go, snorkeling and all that?
I went scuba diving and then we went snorkeling. I saw a ton of sharks. I think it was mostly nurse sharks. I'm not sure. I don't remember. No, they were just little sharks.
Yeah, black tip reef sharks or white tip reef sharks. Yep.
Yeah. It was cool. I personally love sharks. I like swimming with sharks. I'm comfortable. I did a shark dive. It was great. But it was beautiful. I'd love to see sharks, especially the little ones, because I'm not terrified of little ones. I'm like, I'm bigger than you. You can't hurt me.
Yeah.
A great white shark I would not want to swim with, but a little average size shark, I'm cool. So you said the reefs were great. The reefs were beautiful. When we went, I noticed some bleaching on the tips of the coral were bleached. They were white. They say it's the global warming. They say the water temperature is too hot. And so when the water temperature is too hot, it starts to die or whatever. But it was beautiful reefs they had. And we went, they have, it's funny, on the last podcast, I did this is a clownfish. When you're underwater, you can't talk. So this was clownfish, and this is like lobster, crabs, shark, shark. We saw some beautiful manta ray.
Oh yeah.
A lot of little stingrays, and just a really healthy ecosystem down below in the reef. It was beautiful in the Maldives. I would go back there. The Bahamas was very beautiful as well. Do you do diving and stuff like that? Like
I don't.
or just
Snorkeling.
Okay,
Snorkeling. We did scuba diving in the Maldives because they let you.
Oh.
And they'll actually train you on site. So I'm not scuba certified,
Yeah.
but they'll kind of train you. I mean, you're not going very deep, right? You're going 8-10 feet, something like that.
Oh,
so,
okay.
No deeper than that really. But, I loved scuba diving when I went. The wife freaked out. So my wife kind of got really claustrophobic, and she doesn't normally get claustrophobic with water, but she was like, whoa, just to, what is it called? Leveling out, right?
So, your equilibrium and the pressure. Yeah.
Equilibrium. She just couldn't figure it out. And,
wow.
I got to about 8 or 10 feet deep. But the first time she just couldn't figure it out, but it's awesome. I mean, it's literally like living with the fish, even great. For that short time, it's pretty amazing.
You can get claustrophobic in your mask, because you're literally in the mask. You have the border and stuff, so you can get claustrophobic from being in the mask, and then obviously being underwater. But I keep trying to get my wife to go, and she doesn't want to do it. She's like, "What if we both die?" And I'm thinking, "Babe, we're on separate breathing systems. Like, you might die, I might die. We're not both gonna die." She didn't like that joke, so she will not be joining me. But she's been snorkeling with me a couple times. So,
that's awesome, man.
Cool. You guys just had your 10-year, or how long you guys been married?
17.
Oh,
you're asking
how old are you, dude? You look younger than that, man.
No, I'm 44.
Oh wow, okay. I'm turning 39. Yeah, you got married young.
Yeah,
wow.
Yeah.
Okay,
right out of I know one speed. It's fast. So we literally, undergrad, med school, got married. We had kids. We waited for our kids for a little while, 5 years or so.
Yeah, because your kids are my kids' age, but okay. So we've been married 10 years. We just had our 10.
Yeah, exactly. So we waited. We traveled a lot again. Just us two traveled as well.
Yeah, that's nice.
Got to see lots of cool stuff. And then now with the kids, it's, life's different, right? Like you try to take them places. We try to get away without them, once in a blue moon, but it's, you almost want them to go with you and explore a lot of these things as well. So
yeah. Cool. Well, all right, man. Anything you want to say about work comp event coming up, or?
Yeah. So we are hosting, we always host a happy hour. We are anyone that wants to come check us out, all you have to do is go to floridapainmedicine.com. You'll see all of our locations, all of our physicians are all fantastic. And like I said, we treat everything from good and bad news, as we treat everything from, your common back pain, neck pain to, end stage pancreatic cancer pain, and, workers' comp and personal injury spaces or auto injury spaces too. And this is a fantastic conference. I think the important thing for patients and adjusters and attorneys to understand is, hey, the ultimate goal, especially for your work comp patient, is get them treated fast, get them back to work in whatever capacity they can go back to. That doesn't mean that we want you to go, if you're an electrician and you have a back injury, I don't want you to go climbing poles, but can you do certain things in the office or, have other jobs? Absolutely. But thank you so much for having me on this podcast, man.
Yeah. Thank you. Appreciate you.
Thank you.
Thanks, man. Thanks for coming by.
No problem.
Appreciate it. Thanks.